Every 40 seconds, someone in the United States has a heart attack. If you're over 60, understanding the difference between normal aging and dangerous warning signs can save your life. The challenge? Heart trouble doesn't always arrive with dramatic movie-style chest pain. Sometimes it whispers. Sometimes it feels like heartburn. Sometimes it sounds like, "I'm just tired today." Today, you'll learn 7 critical warning signs your heart may be sending you. I'll explain what each one means, what to watch for at home, when to call 911, and what to ask your doctor next. Most importantly, you'll see why symptoms that seem harmless, like fatigue, swelling, or indigestion, can be urgent when they show up in a certain way. Before we continue, remember, this video is for education. If you're having concerning symptoms right now, pause this video and call your healthcare provider or call 911. Your heart after 60. What's changing and why it matters. As you age, your cardiovascular system changes. Blood vessels become less flexible, so your heart works a little harder to push blood forward. The heart muscle can thicken slightly. Electrical signals that coordinate your heartbeat can become more erratic. These changes are common, but they narrow the margin for error when something new appears. Statistics highlight why vigilance matters. Among adults 60-79, a large proportion live with some form of cardiovascular disease, and the percentage rises further after age 80. This isn't to frighten you, it's to give you permission to pay attention. Too many older adults shrug off warning signs as just getting older. Your body is not your enemy. It's a smart messenger. When it speaks, your job is to listen. Heart disease remains a leading cause of death for older men and women in the United States. And yet, many heart problems are very treatable when caught early. Early action preserves heart muscle, prevents complications, and protects independence. Let's also address 3 common myths. 1. Heart attacks always cause crushing chest pain. Not true. Many people, especially women, experience shortness of breath, nausea, back or jaw pain, lightheadedness, or extreme fatigue instead. 2. Heart disease is mostly a man's problem. Not true. Women are at significant risk, and their symptoms can be different. 3. If I feel fine, my heart must be healthy. Not necessarily. High blood pressure, high cholesterol, diabetes, and early artery plaque can be silent for years. Your personal risk factors matter. Diabetes, high blood pressure, high cholesterol, smoking, even in the past, being overweight, a sedentary lifestyle, sleep apnea, kidney disease, and a family history of early heart disease. If any of these sound familiar, take today's signs especially seriously. Now, let's walk through the 7 warning signs, what they look like, why they happen, and what to do. Warning sign number 1. Chest discomfort that comes and goes. Not every twinge is a heart attack, but any new or changing chest discomfort deserves attention. Heart-related pain often feels like pressure, tightness, squeezing, fullness, burning or aching in the center or left side of the chest. It may spread to your shoulders, arms, back, neck, or jaw. It may last more than a few minutes, or ease up and then return. 2 patterns matter. Stable angina. Discomfort with exertion that eases with rest or nitroglycerin. This suggests the heart muscle isn't getting enough oxygen when you push yourself, often due to narrowed arteries. It's not an immediate 911 emergency if it's your known, usual pattern, but it is a sign you need to talk with your doctor promptly about better protection. Unstable angina, discomfort at rest, with lighter activity than usual, or more intense, longer than before. That's a 911 situation because it can precede a heart attack. What you can do right now. If you're experiencing new chest pressure or pain that lasts more than 5 minutes, especially with sweating, nausea, shortness of breath, or lightheadedness, call 911. Don't drive yourself. If you have a prescribed nitroglycerin, take it as directed while you wait for help. Warning, sign number 2. Unusual shortness of breath. As you get older, climbing stairs might make you winded, but new or worsening breathlessness is different. If making the bed, walking to the mailbox, or talking on the phone makes you pant in a way it didn't last month, pay attention. Specific red flags: breathlessness when lying flat. You sleep better propped up. Waking at night gasping for air. Needing extra pillows to breathe comfortably. Feeling winded doing routine chores that were easy before. Why this happens? When the heart can't pump efficiently, pressure backs up into the lungs, causing fluid buildup that makes breathing harder. Shortness of breath can also occur with silent heart attacks, valve problems, or abnormal rhythms. What you can do: track when breathlessness happens, how long it lasts, and what helps. Weigh yourself daily in the morning after using the bathroom. Rapid gain, 2 to 3 pounds in a day or 5 pounds in a week, can signal fluid retention. If shortness of breath is sudden or severe, especially with chest discomfort, sweating, or fainting, call 911. Warning sign: Nurt 3, irregular heartbeat or palpitations. Your heart normally beats 60 to 100 times per minute in a steady pattern. As you age, rhythm problems become more common. One of the most important is atrial fibrillation, AFib, a fast, irregular rhythm that raises stroke risk if untreated. What you might feel: a racing or fluttering heartbeat that starts and stops suddenly. Skipped beats or a heartbeat that feels chaotic. Fatigue, shortness of breath, chest discomfort, lightheadedness, or reduced exercise tolerance. Why this matters: in AFib, the top chambers of the heart quiver instead of squeezing in sync, which can allow blood to pool and form clots. If a clot travels to the brain, it can cause a stroke. The good news: treatment reduces that risk dramatically. What you can do: check your pulse when you feel symptoms. Is it steady like a drum or hopping all over? If palpitations are new, frequent, last more than a few minutes, or occur with dizziness, chest pain, or fainting, seek medical care promptly. Ask your doctor whether you should use a home blood pressure monitor with AFib detection or wear a short-term heart monitor. Warning: sign number 4, swelling in legs, ankles, or feet. Swelling, edema, isn't just a cosmetic issue. If your shoes feel tight by evening, if sock marks stay indented, or if pressing a finger into your shin leaves a pit, you may be retaining fluid. Why this happens: when the heart's pumping power is weak, especially on the right side, blood backs up in the veins. Gravity pulls fluid into your lower legs and ankles. Certain medications, vein problems, kidney disease, or sitting for long periods can also contribute, but new swelling should never be ignored. What you can do: track swelling by time of day and activity. Note any rapid weight gain, again, 2-3 pounds in a day or 5 in a week. Elevate your legs when resting and avoid sitting for hours without moving. If swelling is new, worsening, or paired with breathlessness, call your doctor soon. If it comes with chest pain or severe shortness of breath, call 911. Warning: sign number 5, extreme fatigue or unusual weakness. Tired happens. Heart-related fatigue feels different. It's the kind of heavy, whole-body exhaustion that rest doesn't fix. You might need a nap after taking a shower. You might struggle to finish a simple chore. You may say, "I just don't have any gas in the tank." Why it happens: when your heart can't deliver enough oxygen-rich blood to your muscles and organs, everything feels harder. In women especially, unusual fatigue can be a primary heart attack symptom, sometimes days or weeks before other signs. Red flags: exhaustion after minimal activity, needing frequent naps despite adequate sleep, sudden weakness that makes routine tasks difficult, fatigue with dizziness or lightheadedness. What you can do: keep a short fatigue diary. Note the time of day, activity, duration, and recovery time. If fatigue is new or worsening, discuss it with your doctor, especially if you also have shortness of breath, chest pressure, or palpitations. If fatigue is severe and paired with other urgent symptoms, chest pain, breathlessness, cold sweats, call 911. Warning: sign number 6, pain in jaw, neck, back, or arms. Heart pain doesn't always stay in the chest. Because nerve pathways overlap, your brain can feel heart distress in the jaw, throat, shoulders, back, especially between the shoulder blades, or arms. Women are more likely than men to experience these patterns, sometimes without chest pain. Signals to notice: jaw pain that worsens with exertion and eases with rest. Neck or throat discomfort without a sore throat or dental cause. Pressure or pain between the shoulder blades. Pain, heaviness, or numbness in one or both arms. What you can do: treat above-the-waist pain with exertion as potentially cardiac until proven otherwise. If these pains show up with shortness of breath, sweating, nausea, or lightheadedness, call 911. Ask your doctor for a personalized plan. If this symptom returns, what should I do first? Warning sign number 7, nausea, indigestion, or upper stomach pain. Many people, again especially women, experience digestive-type symptoms during a heart event. It can feel like bad heartburn, an upset stomach, or a tight band under the ribs. You might blame last night's dinner, but when indigestion appears out of the blue, is unusually strong, or occurs with other heart symptoms, take it seriously. Watch for sudden nausea without obvious cause, burning under the breastbone that doesn't respond to your usual antacid, upper abdominal pressure or pain, sometimes radiating to the back, vomiting paired with shortness of breath, cold sweats, dizziness, or chest discomfort. What you can do: if digestive symptoms are intense, new, and accompanied by other warning signs, don't wait. Call 911. If you've had persistent, milder indigestion over days or weeks, schedule an appointment to evaluate both gastrointestinal and cardiac causes. When to call 911 versus when to call your doctor. Knowing the difference saves lives. Call 911 immediately if you have chest pain, pressure, tightness lasting more than 5 minutes, chest discomfort plus shortness of breath, sweating, nausea, or lightheadedness, sudden severe shortness of breath, fainting, new confusion, or you feel like you might pass out, sudden trouble speaking, seeing, walking, or a severe headache, possible stroke. A known history of heart disease and a new pattern that feels different or worse. Why 911? Emergency responders can begin treatment right away. Check your rhythm, give oxygen or medications, and alert the hospital so a cardiac team is ready. Do not drive yourself. Call your doctor soon if you have mild recurring chest discomfort that comes and goes, new or worsening fatigue that limits daily life, legs swelling without severe breathlessness, palpitations that are brief and not accompanied by fainting, chest pain, or severe shortness of breath, gradual weight gain, rising blood pressure readings, or new exercise intolerance. If you're unsure, err on the side of caution. It's always appropriate to call 911 when symptoms feel serious, sudden, or alarming. Prepare for success. What to track and bring you are the expert on your own body. Help your care team help you. Keep a simple symptom diary. When symptoms occur, time of day, after meals, during activity, at rest. How long they last. What makes them better or worse. Any associated signs: sweating, nausea, shortness of breath, dizziness, palpitations, swelling. Bring an updated medication list: prescription drugs, over-the-counter medicines, vitamins, and supplements. Include the dose, how often you take it, and why you take it. Note allergies or past side effects. For example, ACE inhibitors caused cough. Know your numbers. Recent blood pressure readings, home cuff, or pharmacy. Blood sugar or A1C if you have diabetes. Recent cholesterol results if available. Weight trend this month. Share your family history. Parents, siblings, or grandparents with heart disease or stroke. Approximate age at diagnosis. Any sudden deaths or early heart problems in the family. Questions to ask your doctor. Write these down and take them with you. 1. Given my age and history, What are my biggest heart risks? 2. Should I have screening tests like an EKG, echocardiogram, coronary calcium score, or rhythm monitoring? 3. What blood pressure and cholesterol goals should I aim for? 4. Could any of my medications, prescription or over-the-counter, affect my heart or interact with heart medicines? 5. Do I need a cardiology referral? 6. Which symptoms should trigger 911 and which should trigger a call to your office? 7. Is daily aspirin right for me? If not, what is the safer plan? 8. How much and what kind of physical activity is safe for me right now? 1. What's the best eating pattern for my heart given my other conditions? 2. If I experience chest discomfort again, what should I do in the first 5 minutes? Create your personal emergency plan. When symptoms strike, you don't want to guess. Set yourself up now. Post critical numbers by every phone and save them in your mobile. 911, your doctor's office, after-hours line, and a nearby family member or neighbor. Carry a medication card in your wallet listing drug names, doses, and reasons, plus allergies and emergency contacts. Consider a medical ID bracelet if you have known heart disease, a stent, valve replacement, pacemaker, defibrillator, take blood thinners, or have diabetes or severe allergies. Share your plan with your partner, family, or close friends. What your key symptoms look like, where your medication list is, and which hospital you prefer if time allows. Practice the steps. If chest pain lasts more than 5 minutes, call 911, unlock the door, sit down, take prescribed nitroglycerin if you have it, and wait for help. Everyday habits that protect your heart. After 60. While today's focus is warning signs, prevention works hand in hand with awareness. These are not complicated, but they matter. Move most days. Even 10-minute walks add up. Aim for a blend of walking, light strength work, like resistance bands, and balance exercises. If you haven't been active, ask your doctor for a safe starting plan. Eat for your arteries. Build meals around vegetables, fruits, beans, lentils, whole grains, fish, nuts, and olive oil. Limit processed meats, high-salt foods, and sugary drinks. Sleep 7 to 8 hours. Poor sleep and untreated sleep apnea stress the heart. If you snore loudly or wake unrefreshed, talk to your doctor. Don't smoke. If you do, ask about modern quit aids. It's never too late for a benefit. Take medicines exactly as prescribed. Skipping doses of blood pressure pills or blood thinners erases their protection. Use pill organizers, phone alarms, or caregiver help. Manage stress. Gentle breathing, prayer, stretching, or quiet time in nature can lower heart strain. Keep vaccinations current. Flu, COVID-19, and pneumonia vaccines reduce infections that can stress your heart. These habits won't eliminate risk, but they stack the odds in your favor and improve how you feel day to day. Putting it all together. A simple action checklist. If you notice any of these, take action today. Chest discomfort, pressure, tightness, burning that lasts 5 minutes or returns. Shortness of breath that is new, worse, or wakes you from sleep. Palpitations with dizziness, chest pain, or fainting. Leg swelling with rapid weight gain. Extreme fatigue that limits basic activities. Pain in jaw, neck, back, or arms with exertion or stress. Sudden nausea or severe indigestion with sweating or breathlessness. Your next steps. 1. If symptoms are severe, sudden, or frightening, call 911. 2. If symptoms are new but mild, call your doctor's office today for guidance. 3. Update your medication card and emergency contacts. 4. Start your symptom diary and bring it to your next appointment. 5. Schedule that checkup you've been postponing. A special note for women. Women's symptoms are more likely to be non-chest symptoms. Shortness of breath, nausea, back or jaw pain, unusual fatigue, or lightheadedness. Sometimes without chest pain at all. If you're a woman over 60 and something feels off, trust that instinct. Your body isn't being dramatic. It's asking for help. You are never bothering anyone by getting checked. We covered 7 critical warning signs after age 60. 1, chest discomfort that may feel like pressure, tightness, burning, or fullness. 2, unusual shortness of breath, especially when lying down or during light activity. 3, irregular heartbeat or palpitations, particularly if paired with dizziness or chest pain. 4, swelling in legs, ankles, or feet, and rapid weight gain. 5, extreme fatigue or weakness that rest doesn't fix. 6, pain in the jaw, neck, back, or arms, with or without chest pain. 7, nausea, indigestion, or upper stomach pain, especially with sweating or breathlessness. The most important takeaway is simple. Listen to your body and act early. If something feels wrong, get it checked. It is always better to be safe than sorry with the heart. Take one small step today. Put your doctor's number in your phone favorites. Start a symptom note on your kitchen counter. Lay out 2 pillows if lying flat makes breathing hard. Ask a family member to learn your plan. Small steps create big protection. If you found this helpful, subscribe for practical, evidence-based health education designed for adults over 60. At Senior Vitality Clinic, we're here to help you stay informed, stay confident, and stay heart smart. Keep listening to your body, keep asking good questions, and keep working with your healthcare team. Stay well, and I'll see you in the next video.